Good afternoon. My name is Gregory Conley, and I currently serve as president of the American Vaping Association, which is a nonprofit that advocates for sensible regulation of vaping products. And first of all, I just want to thank the organizers of GFN, not simply for inviting me to speak and not just for putting on an excellent event every year, but for pushing forward and holding GFN 2020 despite all of the terrible circumstances, for putting it online for free for the world to see. Hopefully, at this time when we are under such enormous pressure, we will get some new voices in the movement, people who don't have firmly held beliefs, have not had their beliefs challenged about nicotine, tobacco, and harm reduction. This is a great event to learn new information. And I hope that next year at GFN 2021 in Warsaw, there will be plenty of new faces that this will have been their first GFN. So I was asked by the organizers to discuss how powerful forces are not always so benign. And when you're talking about powerful forces making mistakes, whether out of maliciousness, incompetence, naivete, you could write thousands and thousands of pages on the subject. So in the context of tobacco control, I think a good example of powerful forces making terrible mistakes, you can sum that up in a time period of July 2019 to October 2019. And in America, that was when we first started to have what started out as a trickle eventually became a never-stopping flow of news stories on lung disease and deaths being caused by vaping. And it started off regionally in the Illinois, Wisconsin area, but soon spread throughout the country. And so by August of 2019, there were stories all around the globe on how America is dealing with a sudden influx of lung diseases and deaths caused by vaping. Well, by the end of August, those who were paying attention were fairly clear that it was not store-bought nicotine vaping products killing and harming people, but that it was illicit THC products where a dealer had added vitamin E acetate in order to cut costs. And Leafly covered that at the end of August. That was soon followed by the New York State Department of Health revealing their own testing results, the Washington Post in a big story reporting on those testing results, and even the FDA coming out and specifically warning about how people should not be vaping illicit THC products bought off the street. All of that, however, did not stop or influence the Centers for Disease Control, which is likely the second most trusted government agency in the United States. So when they say something, generally the American public listens and takes it as truth. They, a powerful force, were putting out into the news media story after story about how we just don't know if nicotine vaping products are causing lung disease, so no one should vape. And we all know now that wasn't the case, but the American public has not gotten that message. And so what you had was in one single week in September, the CDC did a usual news conference saying we just don't know. We had the Michigan governor, Gretchen Whitmer, use the lung injuries and deaths as an excuse to ban flavored nicotine vaping products. You had Michael Bloomberg announce that he was going to be supporting Campaign for Tobacco-Free Kids with an additional $160 million with the end goal of banning the sale of flavored vaping products. And you had our HHS Secretary, Alex Azar, who oversees the CDC, using these lung injuries and deaths to convince President Trump that he should take action to ban the sale of flavored vaping products. So you had this confluence of factors where you had a CDC that has never met a harm reduction product that it has not liked. And you also have a CDC that is so closed off from the rest of the world, does not want new information to come that has not originated with its own researchers. And you have the natural inkling for prohibition shared by many groups throughout the United States taking advantage of this epidemic to push their own pet policies. So this $160 million from Michael Bloomberg came about in the middle of this lung disease epidemic. All of these news stories have only led to Americans and people around the world believing that nicotine vaping products cause illness. The CDC insisted upon relying on patients' records, patients saying whether or not, admitting whether or not they had used illicit THC products. All the evidence to the contrary, the Washington Post, the New York State Department of Health, other departments of health, were ignored. And so the CDC fueled this misinformation epidemic, and then Bloomberg jumped on top of it. And Bloomberg Philanthropies, they have donated over $1 billion to the anti-tobacco fight. And instead of recognizing that vaping products are actually a part of the anti-cigarette fight that he has been fighting for so many years, instead, they are now using money that could be used to go after cigarette companies to fight the vaping industry. These powerful forces are trusted. They are viewed as good people looking to do good deeds. They are even funding journalism, such as The Guardian and the Bureau for Investigative Journalism. They are giving these groups likely hundreds of thousands, if not millions of dollars, to do work that vilifies people who are trying to reduce harm. These powerful forces will not stop. These powerful forces will not become delegitimized anytime in the near future. They are well funded and they will not stop. So that is why we need new voices, we need loud voices, we need consistent voices. And the only way that we are ever going to win, and a win is smokers being able to continue to access these products and not being misinformed, is with help from people like you. That barely, as I said, scratched the surface on this topic. I'm sure Clive Bates will drive it home with his. I'm always happy to answer any questions, but thank you all for listening to me, and I hope you all have a good day.